Welcome to AfricaCom TV here in Cape Town, South Africa. We're joined by doctor, presenter, executive producer, and founder of Hello Doctor, Dr. Michael Mol.
Wow,
Welcome.
Amy, thank you for the introduction. That's fantastic. And no water cue. She just said that, man. That's amazing.
I'm well aware of the unusual dynamic we have here.
I'm loving it, by the way.
Completely.
That's true, yeah.
The irony is not lost on me. Welcome to AfricaCom. How are you enjoying yourself?
It's been amazing. It's been my first AfricaCom, and first impressions, it is big. It is bold. It's almost an assault on the senses. There's too much to see, too much to do, and too much to listen to that I just feel like I just can't take it all in. So it's a bit like drinking from a fire hydrant, but it's been fantastic.
Well, thank you for all those lovely recommendations. I agree. We consider ourselves a festival of African tech and technology. It is bigger this year. And very comprehensive. So we hope there's a lot of people to dip, for people to dip in and out of. So
sure.
You've been heavily involved on the mobile money and mobile health initiatives, that kind of stream in AfricaCom.
Sure.
Before we get into your involvement at AfricaCom, I'd like to talk a little bit about your background, your career. It's a multifaceted one. You're a doctor and producer. How did you first decide to get into the medical profession, pivot over to presenting, and then into mobile health and mobile initiatives?
It's a long story. It's hard to tell shortly, but I had an uncle, 23, died from a heart attack as a medical student, got my name from him, and ever since then wanted to be a doctor and carry on what he didn't finish doing, and did that. And got into the medical field, loved it. I've always had a passion for health and helping those who needed it. And then by chance got into media, did something really silly and long story, and got into television, and the opportunity came by, and it was really a case of saying yes to certain things and no to others. And at one point it was all media and all medicine. I had to make a call and decided I've got the degree, I could always go back to being a doctor at a later stage. Let me chase media for a while, and did that. It turned out to be a little longer than just a while. It was about 10, 12 years. And then I guess my first love of medicine came back and just said, you need to fill that empty spot inside of you, and I've done that. So it's been a wonderful ride. I've managed to, I suppose, combine my love of media and my love of medicine into this neat little ball and tech, and come up with Hello Doctor.
And it works. I'd like to talk a little bit about Hello Doctor. How did you first come up with the idea, and how have you seen it grow and develop since it's first, been since its inception and founding?
Well, the idea needed to happen. I mean, Africa, to throw a few stats your way, Amy, 25% of the world's burden of disease is in Africa. 3% of the healthcare workers, 1% of the health expenditure. So we're in a healthcare crisis. And there are not enough doctors or healthcare workers to make a difference. The result is we live shorter than anybody else does. So the average life expectancy around the world is 71. In Africa, it's 56. It's 15 years less than the average human being. And if you multiply that by the billion Africans on our continent, that's 15 billion wasted years every generation, and not on my watch. So we asked ourselves the question, how do we address that giant, that issue? How do we meet the needs of so many people over such a vast continent in a way that's affordable and viable? And we came up with Hello Doctor, access to a doctor on your mobile phone, because there are more phones in Africa than there are people.
Exactly. And how does Hello Doctor work in connecting the disconnected? Because not everybody has access to the internet or a smartphone. So is your platform available for those not on a smartphone handset?
It is. So the vision was, irrespective of your device, you will have access to Hello Doctor services. So you could have, as you described earlier, a brick phone or a basic black and white monochromatic screen phone. You can still access Hello Doctor via USSD or via the web if you can, or via an app if you have a smartphone. It doesn't matter. If you have a mobile device, you can get hold of our doctors, or more importantly, our doctors can get hold of you. And I think that's key for Hello Doctor. Is a lot of telemedicine initiatives have failed because they've expected users to phone in to the call center. Where we're saying, no. For too long, doctors have expected patients to come to us in our clinics and our rooms, and we're the center of attention. Now we're saying, no, make the user or the consumer the center of attention, and when you need a doctor, you give us a call and we'll phone you. And that's the big idea behind Hello Doctor. Is when you need a doctor, we're on the end of the phone within an hour, and we'll call you and find out how we can help you.
That's wonderful. And what kind of regions is Hello Doctor available in? What is your reach?
Well, we're in South Africa. That's where we started. That's
Yeah.
the birthplace of Hello Doctor. We're also in Zambia and in Mauritius. We're in Kenya. We're in Indonesia, and we're about to go into India as well. Expansion plans, obviously, into Africa, very big. We have partnered up with one of the MNOs in South Africa and looking to, tag into the back of their expansion plans and provide mobile health as widely as we can.
That's wonderful. And moving on to your involvement at AfricaCom, you presented with Hanley Smuts of MTN on getting access to mobile health initiatives such as Hello Doctor. What were the major takeaways from that session?
What I did is really presented a case study of what we've done. I think we all know that we need to collaborate. We need to have the public-private partnerships in place. Multi-platform capabilities are very important. I didn't want to beat that drum again and again and again ad nauseum, but rather just to say, here's what we've done, and this is what we've learned, and this is where we failed. And it was a great session to sort of say, this is the concept, this is how it works, this is how anyone can have an access to doctor anytime, anywhere, 24/7, and this is how you pay for it. And Kenya is a good example of a great product that was too complex and hasn't quite worked the way we'd hoped. South Africa, great product, limited in scope of practice because of the health ministry here, but far more widespread. So it was an interesting case study, and I think got a lot of good feedback.
Great. And how do you see Hello Doctor growing and developing in, say, the next 2 to 3 years? What's in store?
Well, as technology advances, so what we can offer our users advance. Right now, the big drive is access to a doctor telephonically, either by talk or text or chat. Okay. In time, you can take a photograph and send us a little picture and sort of say, what do you think this is? Or, could this rash be sorted out? Not only doctors, but now we're giving access to counselors and psychologists and healthcare workers and nurses. So the systems are in place. They're stable, they work, it's a confidential one-to-one engagement. And now it's whoever we choose to put at the back of that is kind of the future. So anything goes. If you'd like advice on anything, just let me know and we can put someone on the back of the phone for you.
The sky's the limit.
Absolutely.
Fantastic.
But the drive is health.
Yes. And having a look at the ecosystem at present, what do you envision for health in Africa? Where do you see us being in, say, the next 3 years? What do you hope to accomplish with regards to mobile health?
Well, I think when it comes to health in Africa, I mean, the big issues are still around. It's sanitation, it's clean water, it's infectious diseases, TB, malaria, HIV. But in 2025, the predictions are that non-communicable diseases, so obesity and heart disease and diabetes, will overtake communicable diseases. Now, that's a crisis, but it's a crisis that can be averted. And we avert that through education and through prevention. And in the next 2 to 3 years, that's really where I see Hello Doctor playing the most significant role, is giving consumers immediate access to doctors, not for cure, but for prevention. So why would I want to speak to a doctor if I really needed an antibiotic or some sort of injection? I'd rather speak to a doctor before I need the antibiotic. What should I take for birth control? How can I fall pregnant easily? How do I avoid catching another respiratory infection? So for me, prevention is the focus for Africa going forward to prevent the chronic pandemic that's coming our way.
Great. Well, thank you so much for sharing your stories with us, and we look forward to hearing back on how mobile health initiatives such as yours develop in the near future. Thank you for joining us at AfricaCom TV.
Absolute pleasure. And in future, guys, if you want to get hold of Amy, look out for the app Hello Amy.
That's very kind. I don't think so, but thanks anyway. Maybe in the near future. Thank you very much. Goodbye.